welcome back to another Medicise video. So today's video is on all you need to know about acute pancreatitis. So let's start off with the physiology of the pancreas. So the pancreas is a gland found behind the stomach and it has two roles. So the first role is aiding in digestion, and it does this by secreting digestive enzymes into the duodenum via the pancreatic duct, which is responsible for breaking down food. So there's three different types of enzymes that you need to be aware of. First is protease, which breaks down protein. Next is lipase, which breaks down fats. And finally, amylase, which breaks down carbohydrates. So the first role is the role of digestion. Now the second role of the pancreas is to secrete hormones. So the pancreas releases two main hormones. The first one is insulin, which is released when there is high levels of glucose. And the second one is glucagon, which is released when there is low levels of glucose. So when thinking about any conditions to do with the pancreas, you need to remember that both digestion and glucose levels will be affected. So what is pancreatitis? Well, anything ending in itis means inflammation. So pancreatitis means inflammation of the pancreas. Now what normally happens in the pancreas is that the enzymes responsible for digestion are inactive within the pancreas. So these enzymes are released as inactive enzymes which do not function. They then only become active when they reach the small intestines. Now in pancreatitis, what happens is that the enzymes become activated whilst they're still inside the pancreas. Now this irritates pancreatic cells, which then causes inflammation, so hence the term pancreatitis. So what causes pancreatitis? Well, a good way to remember this is I get smashed. So the I stands for idiopathic, which just means that we don't know what's causing it. G stands for gallstones. E for ethanol, i.e. alcohol. T for trauma. The S stands for steroids. M stands for mumps. A, any autoimmune conditions. S stands for scorpion sting. I know, a very rogue one, but somehow the one that everyone remembers. H, hyperlipidemia and hypercalcemia. E stands for ERCP, and D for drugs. So I get smashed is a good acronym to remember the causes of pancreatitis. However, I do appreciate that that's a lot to remember. So if there's anything that you remember from this part of the video, is that alcohol and gallstones are causes of pancreatitis. And that's because these two are the most common causes of pancreatitis. So let's now look into why alcohol and gallstones cause pancreatitis. So let's start off with alcohol. There are multiple mechanisms for why alcohol causes pancreatitis. One of them is that the byproducts of alcohol metabolism are toxic to the pancreatic cells, and through damaging them, it causes inflammation, hence pancreatitis. Now, gallstones work in a different way. So the gallstones can slip out of the gallbladder and block the common bile duct. Now, this forces pancreatic enzymes back into the pancreas, and the enzymes then become activated and irritate the lining of the pancreas, hence again leading to inflammation. So how does pancreatitis present? Well, the common symptom that patients complain of is epigastric pain radiating to the back. They can also present with nausea and vomiting and a fever. Now, two specific signs to remember of pancreatitis is Gray-Turner sign and Cullen's sign. Now, these signs are actually not often seen in patients with pancreatitis in the hospital. However, for exam purposes, they are very important to know. So Gray-Turner sign is bruising to the flanks, whereas Cullen's sign is bruising around the umbilicus. So a good way to remember this, or how I like to remember this, is Gray-Turner's is two words, therefore bruising in two areas, the two flanks. Cullen is one word, hence only has bruising around one area, which is around the umbilicus. So how do we diagnose pancreatitis? Well, let's split the investigations into three categories: bedside, bloods, and imaging. So bedside investigation includes observations, doing an ECG, checking the patient's blood sugar levels, and of course, in any female of childbearing age presenting with acute abdominal pain, it's important to do a pregnancy test. Now the next step is to do some blood tests. So amylase is the most sensitive blood test for acute pancreatitis. So a raised amylase is defined as 3 times the upper limit of normal. Now, amylase can rise rapidly within 3 to 6 hours of onset of symptoms, and it can remain elevated for up to 5 days. Now, there are other conditions where amylase can also be raised in. So a more specific enzyme which could be used is lipase. Now, this usually peaks at 24 hours, and it will remain elevated for a lot longer. So it can be elevated for around 8 to 14 days. Other blood tests include doing an FBC and CRP to check for any raised inflammatory markers, checking U's and E's for kidney functions and electrolyte, LFT in any patients presenting with abdominal pain, bone profile, LDH, serum glucose, lipids, and ABG. Now, those blood tests are just done purely for the classification system of pancreatitis, which we'll come into in a moment. Now, the last step is to do imaging. So CT abdo-pelvis is the imaging of choice. However, if we are thinking of gallstones as the cause, an ultrasound can also be used. Now, the classification system for pancreatitis is called the Modified Glasgow Score, also known as MGS. Now, this score is used to assess the severity of pancreatitis. So if the score is above 3, then that counts as severe pancreatitis. So if we have a look at the criteria, an ABG was required because we need to do the PaO2 levels. We need the glucose levels, calcium levels, urea and electrolytes. So in order to find out these values, blood tests need to be done. So a good way to remember these is by the acronym PANCREAS. So how do we manage pancreatitis? Well, the main management of pancreatitis is supportive and ensuring that complications do not develop. So ensuring they have a low-fat diet, IV fluids to ensure they stay hydrated, analgesia, a catheter to monitor urine output. If the patient is vomiting, then putting in an NG tube to reduce the risk of aspiration. And ultimately, treating the cause of the pancreatitis. So for example, if the cause is gallstones, considering ERCP or a cholecystectomy if it's appropriate. Now, it's important to note that antibiotics are not often used for management. It's actually only used if there is evidence of complications. Now, there are 3 main complications of pancreatitis. That's necrotizing pancreatitis, peripancreatic fluid collections, and pancreatic pseudocyst. Now, the main complication that we're worried about is necrotizing pancreatitis. All right, now it's time for our quiz. So there are 5 questions in this quiz, and around 15 seconds will be given for each question. If you feel like you need more time, feel free to pause the video at any point. So the first question, which of the following is not a cause of pancreatitis? Is it gallstones, hypocalcemia, trauma, or steroids? All right, let's have a look at the answer. So the answer is hypocalcemia. So if you remember, hypercalcemia, i.e. high levels of calcium, is a cause of pancreatitis, but hypocalcemia, a low level of calcium, is not a cause. Now, the other options were gallstones, which is a cause, trauma, also again a cause, and steroids. All right, let's move on to question number 2. Which imaging modality can be used to diagnose pancreatitis? Is it MRI, abdominal X-ray, CT-AP, or PET scan? All right, let's have a look at the answer. So the answer is CT-AP. So a CT abdominal pelvis is used to diagnose pancreatitis, and that's because on the CT scan, you'll be able to identify the inflammation around the pancreas. All right, question number 3. For the Modified Glasgow Score, which of the following markers is not considered for acute pancreatitis? PaCO2, glucose, urea, or albumin? Let's have a look at the answer. So the answer is PaCO2. So PaO2 is part of the Modified Glasgow Score, but PaCO2 is not. All right, question number 4. What is the management of pancreatitis? Let's have a look at the answer. So the management of pancreatitis involves fluids, analgesia, nutritional support, and it's important to remember that antibiotics are not routinely given. They're only given for complications. Now, question number 5. What are 2 complications of pancreatitis? So let's have a look at the answer. So there are 3 complications to be aware of. So any 2 of these would have been right. So necrotizing pancreatitis, peripancreatic fluid collection, and pancreatic pseudocyst. All right, so that's the end of the video. I hope that was useful. And if you do have any questions, please leave it in the comment below. Hope you all have a great day and see you in the next video.